guys, this is Dr. Hub. Today we look at the indicators, and this is of the body fat. So the indicators of body fat, they include the body weight. So this body weight is nothing but the +3 SD, that is the standard deviation, and this is from the median weight, and this is for height, as this is weight for height, and this is as a cutoff point for obesity. So for adults, some people they calculate the various other indicators such as the body mass index. So for adults, they consider the other things such as the body mass index. So body mass index is also known as the Quetelet index. The Quetelet index, and this is nothing but the weight. So there is a weight. Weight is taken in gauge of kgs and you divide it by the square of height in meters, and this will be nothing but meters. Next comes, there is something known as a ponderal index. So what is meant by the ponderal index? The ponderal index is basically the weight. So you take the weight in grams and you multiply it with 100 divided by the length in the centimeters, So basically it is involving just the weight and the length. And next we also have something known as a corpulence. There is corpulence index. So what is meant by the corpulence index? Corpulence index is basically the actual weight. So there is a actual weight. So this actual weight is divided by the desirable weight. Actual weight is divided by the desirable weight, and this should not exceed 1.2. It should not exceed. So not exceed the 1.2. Then comes the index, that is a Broca's index. So what is Broca's index? Broca's index is nothing but the height divided by minus the 100. So height in centimeters divided by 100 will give you the Broca's index. Then let's look at the Lorentz formula. So a Lorentz formula basically means that there is a height. So this height is nothing but in centimeters, and you subtract about 100, and then you further subtract the height in centimeters minus 150, and this is divided by 2 for women and 4 for men. 2 is you divide it for women and you divide it by 4 for men. So this was the Lorentz formula. Next there is skin fold thickness. So this skin fold thickness is 4 sides, that is the mid triceps. So there is mid triceps and there is biceps. There is also the subscapular. And also the suprailiac regions. So the sum of the measurement should be less than 40 mm in boys. So the sum, if you see, it should be less than 40 mm, and this is basically present in boys, and it is 50 mm. So you consider it less than 50 mm, and this is in terms of the girls. So next we'll look at the waist circumference and the waist hip ratio. So waist circumference and also the waist and the hip ratio. So in this case, at the midpoint between the lower border of the rib cage. So you have a midpoint, and this is at the lower border of rib cage, and the iliac crest, and also the iliac crest. And what we see is there is an increased risk of metabolic complications. And this will be for men. This metabolic complications will be for men, and with the waist circumference, and this is with the waist circumference, that is 1.2 centimeters. And also women with the waist circumference 88. And for men it will be around 1.2 approx, and for women it is going to be 88 centimeter. So a high WHR, high WHR, it is basically greater than 1 in terms of men, greater than 1 in men and greater than 0.85, and this will be in terms of women. So all this, it indicates an abdominal fat accumulation. All this, it indicates abdominal fat accumulation. So then what are the other indicators of body fat? It includes the total body water as well as the total body potassium and the body density.